Hello friends, welcome to MedCode Vision. First of all, I would like to say Happy New Year to all. In the last session, we have seen about the digestive system. In this, we are going to see the respiratory system. What is a respiration? That is the air which is moving in and out from the lungs. It is the respiration. Generally, in medical terms, it is the inspiration, that is the moving in. The air which is moving in is the inspiration. The air which is coming out from the lungs, it is the expiration. Both the inspiration and the expiration is combinedly we called the respiration. Let me see the anatomy of the respiratory system. Respiratory system starts from nasal cavity and ends in the alveoli. Through the nose, the air enters into the body. From the nose, it passes into the larynx, that is the voice box, and next it passes to the trachea, that is the windpipe, and from the windpipe, it reaches into the bronchus, next to the subdivision bronchioles, and finally it reaches the lungs and ends into the alveoli. Lungs plays the major role in respiratory system. Usually the lungs divided into right side and the left side. The right side of the lung has 3 lobes, whereas the left side has only the 2 lobes. The lung is protected by a membrane. It is called the pleura, and the space in between the 2 lungs, it is the mediastinum, where the heart is situated. Then the lung is separated from the abdominal cavity by a thin membrane, thin layer. It is called the diaphragm. Now we will see the common respiratory conditions. Atelectasis, it is the collapsed lung. The expansion of the lungs may be incomplete. Hyperapnea, the respiration depth may be increased, not the respiration rate, that is the respiration depth may be increased. Tachypnea, excessive rapid breathing. Like, what is the difference between the tachypnea and hyperapnea? In the hyperapnea, due to increased depth of breathing, the breathing rate may be reduced. But in the tachypnea, the breathing rate will be faster. Asphyxia, due to severe hypoxia, that is reduced oxygen supply, there may be a blockage of breathing. Next is the epistaxis, bleeding from the nose. Asthma, it is the most common condition found among the people. It is a chronic inflammatory disease. Bronchiectasis, bronchus may be dilated due to some infection, secondary infection. Chronic bronchitis, inflammation of the bronchus. Emphysema, it is also the one of the chronic inflammatory condition where the air sacs may be hyperinflated. Pneumonia, it is inflammation and infection of alveoli. Tuberculosis, it is the most common found among the peoples, the TB. It is an infectious disease caused by the Mycobacterium tuberculosis. Not only lungs involved, but the whole body, any organs of the body may be affected. Pleural effusion, it is the accumulation of fluid in the pleural space. We have seen the space in between, that is an outer protecting of the lung, the pleura. That space may be filled with fluid, that is the pleural effusion. Pleurisy, inflammation of pleura. Pneumothorax, collection of air in the pleural space. If it is filled with fluid, it is the pleural effusion. If the pleura is filled with air, it is the pneumothorax. COPD, it is chronic obstructive pulmonary disease. Hydrothorax, it is a collection of fluid in the pleural cavity. Pleural cavity is where the lung is situated, that is the thoracic cavity. Whereas the pleural effusion is fluid collection in the pleural space. Pulmonary infarction, occurrence of necrotic tissue in the lung cancer. It is generally found the carcinoma of the lungs. So far we have seen some of the common anatomical conditions and some anatomy of the respiratory system. The next comes is the diagnostic study. The chest X-ray, computerized tomography, scopies, bronchoscopy, laryngoscopy, mediastinoscopy, thoracoscopy. Lung biopsy, a small portion of the lungs may be taken for study. Pulmonary function test, generally the PFT. Tuberculin test for TB test. Pulse oximetry to see the respiratory rate. Lung cancer screening. Here finally comes with the treatment. Trigger conditions. Avoiding the triggers, it is the number one way to control all our allergies and asthmatic conditions. Medications. Changing our lifestyles like avoid smokings, yoga classes, using of inhalers, breathing exercise. This may also reduce our respiratory conditions. Pulmonary rehabilitations, using of nebulizer missions, long-term oxygen therapy and ambulatory oxygen therapy. Surgical treatment like pneumonectomy, that is a part of a lung or a lung may be removed. Lobectomy, a particular lobe may be removed. Lung transplant. These are the some of the treatments in the respiratory system. I'll see you in the next class with some other topic. Thanks for watching.